Okay, so hi everyone. So I hope you can hear me. So today we are back with the national license exam practice. So today we're gonna go through our B.1.8, which is our general pharmacology. So yeah, let's get started so we can finish this fast. So okay, let's start with the first question. So first question is a male with gout and he have an episodic attack at big toe. Or right now he doesn't have any symptom and he have increased serum or uric acid. So which medication he need to take to prevent the attack? So or in this question, so as you know that or normally there are like some there are few drugs which can be used in case of gout, like there's there's allopurinol, there is for febusostat and rasburicase, like those kind of drugs. Phe I forgot the spelling, yeah, but febosostat, something like that. Then raspberry and there's rasburicase. In this case is probably used on allopurinol because allopurinol is our xanthine oxidase inhibitor. Xanthine oxidase inhibitor, which can prevent the which can prevent the excess or serum uric acid, which further prevent gouty attack. But as for if the current like gout have a symptom, you usually use colchicine, which is used for acute gout attack. So this one, acute gout attack, is colchicine because it can help or you relieve your pain. Yeah, so that should be the answer for this one. So next question. So a 50 years old woman presented with high grade fever and chills. Hemoculture revealed a pseudomonas aeruginosa, and she undergone some like antibiotic treatment, and her creatinine clearance is decreased to 50. So which drugs she probably used? So this case you have to remember like the anti-pseudomonas drug, anti-pseudomonas, which the drug are carbapenem, yeah, carbapenem, then ceftazidime, or cephaloperazone, something like that. Cephaloperazone. So then ciprofloxacin, and colistin, aminoglycoside. Then there is piperacillin and tazobactam, which is these two. So basically, all these are anti-pseudomonas drug, as you can see the name, like all anti-pseudomonas. Imipidine, I'm not sure about this one, which I think is unlikely, but amikacin, this one, amikacin is an aminoglycoside, which is also an anti-pseudomonas drugs, and an amikacin usually cause nephrotoxicity, which would correlate to this person decrease in creatinine clearance. So the best answer probably is amikacin. Yeah. So okay, so next question number 3. So vaccine X is unable to initiate T cell response. So what should be added to this vaccine? Okay, so in this case, the thing should be added should be adjuvant, because if you don't know, adjuvant usually enhance body like immune response, which would help or initiate T cell response. Yeah, so that should be the answer. Just add adjuvant. Okay, so question number 4. So Montelukast are given to 5 years old child to treat asthma. So what is the mechanism of this drug? So Montelukast is leukotriene antagonist. It it have to be LTD4 receptor antagonist, because LTD start from L, probably leukotriene. Even if you don't know, you can just use your common sense, it should be right. Okay, so next question. So 400 milligram IV drugs and volume distribution of 10 L and half-life of 2 hours, MIC of 9. So how long can the drug like last? So MIC is minimum inhibitory concentration. Minimum inhibitory concentration, which means is the minimum amount of drugs which can inhibit the the pathogen. Yeah. So in that case, or you can use this formula. This formula is dose. Oh wait, sorry. Okay, yeah. There's a formula of dose is equal to volume distribution into plasma concentration. Yeah, so the dose here is 400. Volume distribution here is 10, and plasma concentration is unknown. We need to find plasma concentration to calculate the half-life. Then after that we can just calculate. So yeah, so it be 400 divided by 10 is equal to Cp, which is plasma concentration, which is 40. Yeah, that are so that means it start with 40. Yeah, it start with 40, which 40 starting in the serum. That means in the next 2 hours, since it is the half-life times, it should be 20, and the next another 2 hours it should be 10, which is the another half-life time. Then another 2 hours it should be 5. But as you can see that if the concentration of it in the serum is 5, that means it's already not working, so you cannot count this. So you probably have to count only the first 4 hours. So I think the answer is 4 hours. Okay, so next question number 6. So a 45 years old man with peptic ulcer has omeprazole for 3 months, which blood hormone increase. So omeprazole is a PIP, is a PPI, which is the proton pump inhibitor. Yeah, it's a proton pump inhibitor, which are used to treat excess gastrin. Like it used to treat like peptic ulcer, something like that, and hence it is given the hormone which probably increase is probably gastrin. Yeah, so that should be the answer. Okay, so next is 20 years old woman present with runny nose, sneezing and dry cough. Her nasal symptom were relieved after taking chlorpheniramine. The stuffed nose got better. What is the mechanism of this drug that caused this? Okay, so chlorpheniramine, short form use is CPM. It is a muscarinic cholinergic receptor, I believe. which is this. Yeah, and or its side effect is sedation. If you don't know, like it main side effect is sedation. Yeah, it make you feel sleepy. Yeah, yeah, it's just a memory kind of question. You just you just need to remember like the drug mechanism. But like yeah, you can recheck. I'm not sure about it, but I think it is. Okay, so question number 8. 25 years old women require multiple minor surgical procedure, drug vaso constrictor action that reduce bleeding in mucosal membrane when combined with local anesthetic. Which of the following is the most likely drug? Okay, so for this question, so it have to be a vasoconstrictor to help reduce the bleeding. So there is epinephrine, which I think is the most correct in this case, because epinephrine is a vasoconstrictor as well as it usually used with anesthetic, like just a textbook kind of definition that it is normally used with anesthetic. Okay, so question number 9. So patient diagnosed with prostatic hyperplasia have difficult urination shortly after taking nasal decongestant. What receptor is involved? So this patient take nasal decongestant, yeah, which I think normally it work to being an alpha adrenergic normally, and like some of the drugs which is nasal decongestants is like pseudoephedrine or like phenylephrine. Yeah, they constrict the smooth muscle. Yeah, they are the one which constrict the smooth muscle of not only the nasal but also like the like the neck of the bladder. Yeah, so like so since this person have a prostate hyperplasia, and like it cause a difficult urination, and like the drugs taken is nasal decongestant, is probably this, because it affect not only the nasal cavity, it also affect the urination system. Yeah, because there's alpha like adrenergic receptor there, and it just happened that it affect it as well. Okay, so question number 10. A 25 years old woman has history of unilateral headache. Seem like a symptom of migraine. Unilateral migraine. She is 11 week pregnant. Which of the following is most appropriate drug to relieve her symptom? Okay, so in this case, you probably need to like remember like which drug should not be used in pregnancy, and like a drug like ergotamine should not be used in pregnancy, so like you can just cut it out. And like for migraines during pregnancy, I think ibuprofen can be used only in first and second trimester. Yeah, it should be able to be used just for first and second trimester, and this person is just like 11 week pregnant, which still fall under this, and hence I think ibuprofen can be used, and the rest doesn't seem to be like the answer for this question. Okay, so for question number 11, so a 30 years old woman suffer from vaginitis and with foul odor, yellow green discharge, itching, burning, and painful sexual intercourse. it reveals a pear-shaped parasite with 4 to 5 flagella. So what is the treatment? So as you see, there's our keyword there, pear-shaped parasite, which you can directly know is a trichomonas. Trichomonas vaginalis, which according to the guideline, the treatment of trichomonas is directly on metronidazole. Yeah, that's just like memories, because like I tried to start with like the chapter which require lots of memory. First I found pathogen, like all the microbes, as well as pharmacology require a lots of like memories, and the rest there are like cardiology, which like you more prone to like common sense and you can answer it, okay, maybe except like EKG or something like that. Okay, so question number 12. So what is the following in pharmaceutical preparation that provide the fastest drug action? So the fastest drug action is F effervescent tablet, because like it helps the drugs to dissolve faster. That's like its main function is that like it the drugs resolve faster. That's why it's effervescent tablet. Yeah. Okay, so question number 13. Are 60 years old women that take HCTZ 50 mg daily for her hypertension has come to the follow-up. Her blood test revealed 3.0 K, which is potassium, which changes at the apical membrane of distal tubule result from this medication. Okay, so HCTZ is thiazide drugs, and I think it affect the electrical gradient. Which I think is most likely the answer, because like it the thiazide inhibit sodium and chloride symporter, which cause an increase in sodium and water excretion, but like your body want to maintain like sodium concentration, so there's a increase in sodium reabsorption and potassium excretion, and I think all this happened because of electrical gradient. Yeah, so I think that's the answer. Okay, so question number 14. 50 years old men present with nausea, abdominal pain. He also have a chronic. He's chronic alcoholic. He stopped drinking yesterday. Yeah, symptom confused, sweating, tremor. Which of the following is appropriate treatment? Yeah, so this person certainly have like alcohol withdrawal syndrome. Yeah, alcohol withdrawal syndrome. Yeah, so it seems like this person is having it because he's chronic alcoholic and he just stopped drinking yesterday, and like symptoms seem like likely. So for this question, so like is probably diazepam, probably, because diazepam is help in detoxification of alcohol withdrawal, and another drugs is disulfiram. These drugs is like discourage person from drinking, discourage from drinking. Like if you take this drug, you probably would not want to drink, but like in this case you probably give diazepam because they detoxify, because like this doesn't treat the symptom. This just like prevent further like alcoholic behavior. So yeah, I think that CPAM is much more appropriate. But like apart from there are CPAM, there are also like other drugs are in this category which can be used, like benzodiazepines, which is a more common name for me, like the drugs which used for like alcoholic withdrawal. And there is lorazepam. Yeah, these two drugs are like I remember it better than the azepam, but like it's the same treatment. Okay, so question number 15. So a 30 years old woman present with numbness in hand feet after taking 2 tablets of ergotamine to relieve headache. So she has a pharyngitis and taken antibiotic. So which of the antibiotic is most likely the cause of it? So it's probably erythromycin, because erythromycin is a macrolide, which is a group of drugs which erythromycin is under it, like all the mycin, which they inhibit cytochrome P450, which they then inhibit ergotamine metabolism. Yeah, they inhibit ergotamine metabolism. Yeah, they inhibit them. So that means it could cause ergotamine poisoning. Yeah, so that should be the reason. Because like if you read in the guideline, all the macrolide drugs have like certain some kind of precaution when used with some drug which need CYP P450. Okay, so next question number 16. So patient with tuberculosis receive anti-TB. So this person have a vision problem. So which drug caused this? Okay, so for the drugs which cause this is probably ethambutol, because ethambutol cause optic neuritis, which like is a vision, like ethambutol, to just remember that it caused something with eyes. That's basically it. And like for the rest, like paracinamide, this one cause hyperuricemia hyperuricemia and rifampicin or rifampin, this one cause orange or like reddish urine. And isoniazid cause like peripheral neuropathy due to vitamin B6 like deficiency. Yeah, so that should be it for like TB medication, like the side effect of the drugs. Okay, so question number 17. So a person who eat ibuprofen with acetaminophen, or how can it cause tubular acidosis? Okay, so for this question, I think because ibuprofen it inhibit prostaglandin production at the kidney, which cause like vasodilation. Wait, yeah, I think it inhibit prostaglandin production at the kidney, which normally prostaglandin cause vasodilation. Hence, since there's no prostaglandin produced, it cause vasoconstriction, which is one of the leading, which can lead to renal tubular acidosis. And acetaminophen is also a nephrotoxicity drug if taken in like high amount. Yeah, so that should be the reasoning at the top of my head, whatever I remember. Yeah. So next is mannitol effect and mechanism. So mannitol is usually used for like diuresis, which like take water out. Is a osmotic kind. Yeah, is a osmotic diuretic. Yeah, so I think that's just is like its mechanism, like it prevent water reabsorption due to osmotic gradient. Reabsorption. Okay, just spelling mistake. Absorption. Yeah, spelling mistake. I'm sorry. Whatever. Okay, so yeah, that should be on 18. Okay, so let's move on. So MRSA, which drug used? This one is vancomycin. Just like remember, like all the MRSA use vancomycin. Okay, so a patient use ACEI. What is the effect? So ACEI is angiotensin converting enzyme inhibitor, which is its full name, and it usually cause renin increase. Like since it is angiotensin enzyme inhibitor, is affect renin, angiotensin, and aldosterone system, which affect the kidney, and like ACE affect here. That means angiotensin needs to reduce, aldosterone needs to reduce, and renin should increase because like there is like a feedback mechanism which is happening. So yeah, renin should increase. Okay, so next question: a maintenance dose of an IV drug in child with 35 kg. No number is given, which that means I cannot calculate, but like the formula is probably dose body weight into drugs per kg. Yeah, that should be the formula of this question. Okay, so the drugs which can treat both HIV and chronic HBV, which is hepatitis B virus and HIV. So the drugs we can treat both of these is tenofovir. Yeah, that should be the best answer. And tenofovir is nucleotide reverse transcriptase. Yeah, transcriptase inhibitor. Yeah, inhibitors. Yeah, that should be the drugs type of it. Okay, so question number 5. So a person have dark urine, and this person have G6PD deficiency. So which drug you should not take? So for your information, so when a person came with G6PD deficiency, is you should not take all the sulfa drugs as well as flavabine. Yeah, and like some of the authors like minor drugs which you should remember, but like I forgot, and I only remember sulfa drug, and like some sulfa drug like from the class of sulfonamide. Yeah, sulfa drug is sulfonamide. which all drugs here, which is sulfa drug, is cotrimazole. Yeah, this one is a false. This one is a sulfa drugs, which should not be taken. So question number 6. So a person found a needle-shaped crystal. This one is gold. Like if you saw this, it's gold, and this person is having like an insane pain. So since there's a pain, you need to treat the pain first instead of preventing gout. So to treat gout pain, you need colchicine. Yeah, so that should be the answer, colchicine, as I already told you. Okay, so this question number 7. This person have onychomycosis, which is the fungus of the nail, and normally you use the treatment you use are terbinafine for this. Terbinafine, spelling there's an E as well. Yeah, terbinafine. That's like standard treatment for onychomycosis. Okay, question number 8. Aspirin is an antiplatelet, and which mediator it undergone through. So for aspirin, it usually aspirin is associated with I'm not sure about this, or it probably thromboxane A2, I think, because as per my knowledge, aspirin is a COX inhibitor. It is a COX inhibitor, and like there's no option here, but like since it is associated with antiplatelet instead of being an NSAID, I think thromboxane A2, which like associated with platelet, seem like the most appropriate answer, even if I doesn't know anything about this question. Like if I guess by common sense, it's probably thromboxane A2. Yeah, that should be my guess because I'm not sure. Okay, question number 9. Pseudo ephedrine to help reduce the like nasal mucus. So what is the effect? So pseudoephedrine effect is alpha 1 adrenergic. That's just like remember kind of question, because like most of the nasal like decongestants, they are alpha 1 adrenergic, most of them, but not all of them. Okay, so question number 10. Ophthalmic atrophy will cause what? So it will cause both mydriasis with cycloplegia. So first, my mydriasis is dilated pupils, and cycloplegia, they are the like paralysis of ciliary muscle, which basically like this ophthalmic atrophy cause like eyes dilation. Yeah, that's it. So it should be mydriasis with cycloplegia, because if your ciliary like muscle got paralyzed, your pupils usually dilate. Okay, so next question number 11. So this person have triglyceride 600, very high triglyceride, and like LDL normal. Yeah, this one is easy. So this one you should just need to answer straight, which is gamfibrocil. The reason is gamfibrocil is under the class of fibrates, and fibrates are usually given in high triglyceride and normal LDL kind of situation, which is this situation. Like simvastatins, this and this, like are more prone to like high LDL instead of high triglyceride. Yeah, so That should be the answer. Okay, so next question, number 12. So mechanism of third generation cephalosporin. I'm not sure about like the generation of cephalosporin where it does, but am certain that most of it are cross-linked peptidoglycan blockage, because like they are the peptidoglycan like in synthesis inhibitor, like most of them, and the rest of the question doesn't, the rest of the choice doesn't seem like to correlate with it. So yeah, cross-linked peptidoglycan blockage for most of the cephalosporin. I would not say just third generation, because I'm not sure. Okay, so question number 13. So a person came with something and the lab have like calcium 8. Yeah, so which drug it is? So calcium, the calcium came just with 8, and I think it's a bit low, and I think furosemide probably can cause that, because if I remember correct, thiazide cause high calcium. This one should cause high calcium, and I don't think mannitol does anything with it. So I think furosemide seems like the best answer here. Like the question is just this much. Like I can only guess by like whatever I have. Okay, so question number 14. So erythromycin does is associated with which hormone in GI? So if you read like standard textbook, they will say that erythromycin usually associated with motilin. Yeah, because it is a motilin receptor agonist. This one is motilin receptor agonist, which then they stimulate intestinal peristalsis. Intestinal peristalsis. Yeah, which basically like they make your like intestine peristalsis faster, hence like faster bowel movement. Yeah, erythromycin can cause like that because they are associated with motilin. Okay, so question number 15. A person came with like numbness of the mouth, weakness of the muscle, and like seem like a respiratory failure. Is say probably tetrodotoxin. And so what the patient ate. So there's toad, there's horseshoe crab, sea urchin, amanita, mushroom, and cobra. Okay, so for this question, since it's mentioned tetrodotoxin. Tetrodotoxin, as far as I remember, is usually present in pufferfish. Like the most typicals are tetrodotoxin animals is pufferfish, and it's block voltage gate sodium channel, which cause all this kind of symptom. But since there are no pufferfish, I think the second best choice is horseshoe crab, because I know that there's some poison in horseshoe crab, but I'm not sure which kind of poison. I don't think it's toad. I don't think it's sea urchin, because we eat sea urchin, and I don't think there's any poison associated with it. So like I think horseshoe crab is my guess, but I'm not sure for this question, because the most typical case is pufferfish. Okay, so question number 16. So the person eats something and like have like a mouthful of like bubbly saliva. Both of these can cause this kind of symptom. Be paraquat, this one is a herbicide, and malathion is insecticide. I feel like both of the answer here are correct. Like it's literally look like it's correct because the question is only given this much. Like the clue is this much, but like malathion usually have like muscle paralysis, muscle weakness. It might have like some kind of brain symptom more than paraquat, which I think paraquat might be better here because like it just explain the symptom, why this like there's like some more associated symptom which should be mentioned for it to be like more a proper choice of for this question. Okay, so the picture show Paragonimus, so which drug? Yeah, so directly Paragonimus is praziquantel. That's the answer. Okay, the answer is already given. Yeah, so that. Okay, so let's go to the last two sections so we can close it because I want to just finish half of it, then we can continue it later. So yeah, first question. Okay, 500 mg of drug X reach therapeutic window in 4 hours. It have a 2-hour half-life. If a patient take 1 gram of drugs X, how long will it take for it to reach therapeutic effect? Okay, so so 500 mg take 4 hours to reach the therapeutic effect. So the half-life is 2 hours each. So this is half-life. So first it should be 250. And after 2 hours it should be 125. Which should be therapeutic dose here. Because it says so. So I think it is. So 1 gram convert to mg is 1000 mg. Yeah, 1000 mg. So therapeutic dose is 125, so that means somehow it had to reach 125. So like you can like maybe put like equation like 500 gram take 4 hours to reach, so 1000 gram, how much hours it will take? So yeah, now 1000 multiplied by 4 divided by 500 should be the answer 1 2, which is 8 hours. Yeah, just basic mathematics, should be 8 hours. Otherwise you can just like calculate like 1000, 2 hours will become 500, then another 2 hours will become blah blah blah, will become 250. Yeah, you can just do like that as well. But yeah, I think just better to use the formula, I think, but I'm not sure about this question. Yeah, I'm certainly not sure about this kind of calculation. Yeah, I just leave it. I think it's 8 hours because the formula says so. Okay, so for question number 2, just another calculation. I'm certainly not that good in calculation. So IV infusion or half-life of 3 hours given from 9 a.m. and 3 a.m. it found out that 6 mg, so till 3 p.m. So 9 a.m. of the next day, how much it will have? That's the question. Okay, so so since half-life is 3 hours, like let me just calculate this way. So 3 p.m. till 9 a.m. of the next day, which is 15 p.m. So plus 3, which is 18, plus another 3, which is 21, plus another 3, which is 24, and plus 9. So 9 18. So wait, 9 is 18. So so it's just 9. So 9 is 3 plus 3 plus 3. So this one is 6 3. 6 3, which is half-life. So I can just 6 divided by 2, which is 3 divided by 2, which is 1.5 divided by 2, which is 0.75 divided by 2, which is 0.375 divided by 2, which is 0.1875 divided by 2. Yeah, that should be the answer. See, wait, not divided by 2, sorry here. See, oh my god. Okay. Which answer should be 0.1875. Yeah, and just put the unit mg per dl with ml. Just like calculation using common sense, I guess, because I don't remember the formula. Okay, so question number 3. Oh my god, another calculation. Okay, so dosage of 2 mg, area under the curve of 10, and duration of 4 hours, bioavailability of 0.5. So what is the clearance? So the formula of clearance is dose into bioavailable divided by area under the curve, which should be 2 into 0.5 divided by 10. 1 1 5 1 0.1. Yeah, should be the answer according to the formula. Okay, so question number 4. I'm already so tired. Okay, so let's finish this fast. So a person got a carbamazepine to treat like aggressive symptom. Then the symptom got better. Then around 3 to 4 weeks, the symptom got worse. And blood investigation show that the amount of drugs is reduced even though the dose of the drugs is the same. So what can cause that? So so the thing which can cause this is probably auto-induction of the hepatic enzyme, which because carbamazepine, these drugs, is our CYP inducer, which means it can cause like more stimulation of hepatic enzyme, which can metabolize the drug faster, which would reduce the amount of drugs in the serum. That should be like the reasoning and the answer. Okay, so question number 5. So drugs company produce like trastuzumab, and right now it's under like our selling process. So what kind of information they should send to the FDA? So I think for this kind of drugs, you need to like find the uh send the bioequivalence of the drugs to the original drugs, like because bioequivalence is like similar dosage form which reach the systemic circulation at the same rate and like extent kind of thing, like to prove that this drug is better or like very like equally effective as the drugs. Yeah, I don't think it's biosimilar because biosimilar means like probably like very similar kind of chemicals stuff, which I don't think is the most probably answer here. I think bioequivalent to original drug is probably like a better answer according to my guess and understanding, which I'm not sure. Like am not sure whether it's A or B. Like just my guess, but I don't think it's compared to placebo. Like I don't think it's compared to placebo. It's probably compared to the real drugs. But I think bioequivalent have more weight in this kind of question. Okay, so question number 6. 50 years old woman has a left breast cancer staging as mentioned. A grade of ER plus, PR plus, HER2 minus with low index of proliferation rate. Okay, so uh, this one is probably hormonotherapy due to the reason of HER2 plus. Because HER2 plus is usually associated with breast cancer, and like since it's negative, I don't think there's a need for radiotherapy. I don't think there's a need for chemotherapy. I don't think there's a need for target therapy. I don't think there's a need for immunotherapy. I think like the direct common sense answer is hormonal therapy. Even though I am not sure what ER is, like ER and PR, and I'm not sure what they meant here in this question, but I think from just seeing HER2 negative as well as like low index of proliferation, I think like you can cut this four out and E is probably the best answer here. Okay, let's go fast. So question number 7. A 10 years old boy has been stung and treat with subcutaneous epinephrine. So what is the second messenger for this agent? So for this or for epinephrine, like second messenger is cyclic AMP. That's the answer, which you just need to remember, because I don't know either. Like sometimes I just memorize everything because I'm too lazy to like understand everything. Okay, so 60 years old man received ophthalmic pilocarpine for medication after cataract surgery. So what is the purpose of this medication? So pilocarpine, yeah, pilocarpine is or cause pupil dilation. Like there's a one question about which we already did. Since it's cause pupil dilatation with no. I think pilocarpine reduce cycloplegia. I'm trying to remember, but I think it's reduce cycloplegia, which means it's reduce paralysis of the ciliary muscle, which should cause pupil contraction. Okay, or this one I'm not really sure whether it cause pupil contraction or pupils dilatation by reduce of cycloplegia. But I think the answer is reduce cycloplegia here, because like since this person also undergone a cataract surgery. I don't think like the rest of the answer seem to be appropriate. That's just like my guess. Okay, so since I don't know, I'm sorry. Like there's some question which am I too confused. Okay, so number 9, HIV patient develop mucous membrane blister of both lips. What is the drug choice for this condition? After seeing this, seem like herpes. Especially when this person have HIV, they are more prone to herpes, and herpes treatment is a cyclovir. That's textbook like memories. Okay, so question number 10. A man present with purulent discharge from his penis. The gram stain of the discharge reveal gram negative diplococci in the white blood cells. So which antibiotic should be given? So as you see, this is in gonorrhea. Yeah, and the treatment for this is ceftriaxone. So for you to remember, most of the gram negative cocci use ceftriaxone as a treatment. Just remember that. Okay, so question number 11. So median toxic dose divided by therapeutic dose, and okay, so there's no question here, but like they probably want us to calculate drug safety. And the formula is TD50 divided by ED50. TD50 is median toxic dose, and ED50 is median effective dose. Yeah, that should be what they want. And question number 12, what is this? Cardiac contraction, I guess. So EP, probably epinephrine. EP plus X. So what is X? For I'm not sure this one, like certainly blank, but like since it's something associated with cardiac contraction, I think epinephrine could just be your guess, because like epinephrine does something with cardiac contraction, that's for sure. But like if X is epinephrine, it means this one is epinephrine plus epinephrine, which maybe like too much epinephrine can reduce like cardiac contraction. Like just my guess. I'm not sure about this question. Okay, so this question. So a person came after taking a marijuana, and the person had hallucination. So what kind of substance cause hallucination? So in marijuana, the chemical which cause hallucination is tetrahydrocannabinol. Yeah, so just remember that's what cause hallucination in marijuana, these chemicals. Okay, so this one same question. I'm gonna answer the same epinephrine. So 71 gram negative diplococci. Okay, probably in gonorrhea, which I'm gonna answer the same, ceftriaxone. Okay, so 84. So this question are insulin aspart and lispro are the product of the advance in DNA recombination technology, modify of amino acid sequence or endogenous insulin, blah blah blah. What is the main purpose of this modification? So since it is DNA recombinant, I feel like it's trying to reduce the allergic reaction, because like insulin you normally like inject in your body, and I think it can cause allergic reaction, and like I think it's trying to reduce the reaction so it doesn't cause like much harm. I don't think it's decreased lipoprotein lipodystrophy, because like I feel like all insulin still cause that and there's no difference, something like that. And the first three one just doesn't read and make any sense to me, and I don't understand the first three questions, so my guess is 4. Okay, so this question is the same, so we'll see the above one. Okay, the person present with vesicles in the lower lips. The person complained with pain of the ulcer. So which drug to treat the ulcer in the lips? So I think sound like herpes. So I gonna answer acyclovir, which is the same answer. Okay, so a person eat a TB drug, tuberculosis drug, and have a neuro symptom. So which drug causes? So as I told you, it's isoniazid, which cause peripheral viral neuropathy caused by vitamin B6 deficiency. The rest, see above. I already explained everything, like all the side effects of it. Rifampin cause orange or red urine. Ethambutol cause like eyes toxicity, or pyrazinamide cause like hyperuricemia. Yeah, so that should be okay. Those two. Okay, this one is the same question once again. It's the same answer. 0.1. 2.14. Glaucoma drug, decrease medication, tropical eye drop. What is this? I don't understand. Pilocarpine eye drop associated with what? I think it associated with cycloplegia, as I answered above, with like no support reasoning. Just my guess. Yeah, it's just my guess. Okay, so carbimazepine. Okay, blah 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 blah. It's the same thing. Induction. Okay, so a person came with tetanus. So tetanus like from our last like discussion in the B.1.8. Tetanus caused by block of release of inhibitory interneuron in transmitter. Yeah. Secondary messenger of epinephrine, as I told you, CM. And this one is the same question, which I think is bioequivalent of original drugs. So yeah, that's it. Yeah, so that's all for this one. We will continue it in the next video. So thank you for watching. Bye bye. See you next time. If you have any question, just like comments or something like that. And like some of the question, I'm also not sure if